Hello all. I decided to shoot a quick video about my experience with COVID and how close I came to dying this last week and what actually transpired by accident, planning, pure luck, the amazing advocates and physician friends and the grace of God. And I thought this would be a good video because it's more my experiences on what transpired that helped me survive, and hopefully others can learn from it too as well. I've been home now for a couple days. I am gonna follow a little bit of notes I got here. So with the COVID fog, I don't want to keep repeating myself. I want to make it quick enough to where people will watch it, learn from it, and not make it repetitious, so that way I could keep in sync. So I apologize if I look down here, look at some notes that I was taking. So this is the experience I want to share with you, and hopefully it'll share for yourself to be able to be an advocate for yourself, for a loved one, family member that you have. The main piece of this, I won't be discussing specific medications. I might say what helped me or what I got, but that's not the pertinent information here. Politics, COVID, it's just my experience. And I think after I explain all the research I've done, I've never seen a video like this of what actually takes place once you go into the ER and what you could do to help yourself and help a loved one survive, okay? So, as I said, the only person that's advocating is for yourself. And the thing is, you can't blame the healthcare workers. Cannot. Been there. I've been doing healthcare for over 20 plus years. I've set up telemedicine around the globe, from deep in the Amazon in Brazil, Nigeria, South Korea, South Africa, hundreds of hospitals and clinics here in the United States, and COVID's just too different. And so hopefully some of the experiences that I bring up here will really help. Who am I? President and CEO of telemedicine.com, 57 years old. My wife and I work out every single morning before we start work. We got a home gym, run on the treadmill. We walk around the lake as long as it's nice out, a mile every day at lunchtime. We're both plant-based at home. So really, advocates for just being in good shape. It's nothing to do with how we look or anything. We just feel great. You feel happy. For us, it's just a way of life that, and also I like to motocross ride my motorcycle, bicycle, snowboard, very active, and we're active people, and that's the way we live. And as COVID was coming about, obviously, in doing research and seeing what the trends were around the globe, we started thinking, okay, we got to be a little bit more proactive. We already take vitamins every day and take care of ourselves, but it's not if, it's when we get COVID. What are we going to do? And it doesn't matter what your plan is. I got to have a plan. So we came up with, for us, seemed to be like the most important thing to do is day one or day two, once we're infected, is to get monoclonal. It just seemed to be the best decision for us. Called around. It was very interesting. A lot of hospitals and clinics said, why are you calling now? You don't have it. I go, no, I just want to be proactive for when that day comes. Okay, yeah, this is what you need to do, and gave us some ideas of what to do when that day came. Many months passed by. My wife and I think we got it. We went out dancing, had a great time, and all of a sudden we got the symptoms. Nothing bad, just stuffy nose, and a little bit of a headache. And so we each did 2 tests each, just to verify that we were both positive. And okay, it's time to implement monoclonal, because now we both are taking our vitamins, we're doing everything right, we're drinking a lot of fluids, we're not suffering bad, it's none of that. So let me make these calls that I had ahead of time. Well, I don't know what changed, but some significant changes happened. called 8 different hospitals and said you can only get monoclonal if you're admitted into the ER. Somebody that works in healthcare, I'm like, no, we're not going to take up a room or a bed or a space for, we just are, it's worse than a cold, but not as bad as a flu. And we'll just get through this. We're just going to keep our vitamins and drinking plenty of fluids. And that's what we decided to do. And I didn't have a temperature greater than, I think it was 100.8. And that's what we're going to do. We're going to just go through this and we'll be okay. And here's where the first intervention piece that I think was extremely pivotal in saving my life. Like I said, 25 plus years of working with surgeons and ministers of health around the globe, and just the best of the best surgeons and everybody. As you work, you develop these great friendships of 20, 25 plus years with amazing physicians that really care about people. And just put those calls out and say, hey guys, what's going on? One of my ENT surgeon buddies said, hey, I'm glad you called because this is the first thing you need to do. You need to get a pulse ox. It checks your oxygen saturation. That's what these guys do. And you should be around 97, 98% of oxygen saturation. And if it starts dropping below 90, you need to get in the ER. And I was like, why? I feel fine. What do I really need to eat? And he said, look, a childhood friend of mine that I've known 40, 50 years didn't follow this procedure, got so far below, there was nothing they could do. By the time he got into the hospital, he's now on positive airflow, and he was telling me he's got a 50% chance to live. And wow, that woke me up. I was like, okay, so my wife and I talked about it. What are we going to do? Luckily, we own a healthcare company. We sell these things for hospitals and clinics to be able to check patients from home and do live screening patients at home. Okay, so I already had a couple here. We started checking. My wife developed an Excel spreadsheet and started checking and going, okay, we're going to check it when you wake up, when you go to bed, when we're checking both of our pulse ox. She stayed at 97, 98. All of a sudden, within a day or two, okay, I'm hitting 89, 88. And now it's dropping, and I'm hearing my surgeon buddy mantra in the back of my head saying, wow, you better take this serious. And I couldn't get anybody on the phone. My own personal doctor, nobody. Everybody's too busy. Too many people with COVID, too much issues going on. So luckily, owning telemedicine, we don't offer services for patients to be able to see doctors. We help large healthcare institutions around the globe, even small clinics, everybody. But because if you do a search for telemedicine on any Google, any search engine around the planet, we usually come up number 1 or number 2 out of millions of results around the world. That's great for access and people find us around the globe, but it's really not good because we get parents calling and emailing from all over the globe, and patients, help us. We have cancer, we have certain types of illness. And wow, we felt so bad going, okay, we don't offer this service, but on our main website we just created a little link, see a doctor here, and we allowed people to connect to services that we partnered with, so at least they got somebody to go to. Nothing to do with our business model at all, but at least had that way before COVID, and that was that service to be able to allow you to do that. The benefit of that is when I couldn't get a hold of anybody else, I'm like, wow, okay, I got to use our own service that we set up for other people. Instantly got a doc on the phone. It was, 9, 10 o'clock at night. Explained what's going on and said, wow, you need to get into the ER. He echoed exactly what my ENT surgeon buddy said. No, this is no joke. You need to get in. And I'm like, I am too short of breath. I can't even make it down to the ER, I think, right now. And no problem. Where's your closest pharmacy? I'm gonna prescribe you. And that was albuterol, I guess. I don't know much about medicine. I'm not a doctor. but I guess it's more for people with asthma or whatever to open up your lungs really quick. It's an emergency type of, that's what it was explained to me. And he also gave me a prescription for steroids. I am in the drive-through at the pharmacy. I couldn't wait. I took an inhaler and it was like, I could breathe for just that moment. It was just, and of course I don't have any oxygen, I don't have anything else. And then drove down the ER. By the time I got down there and talked to them, told them what was going on, they gave me a chest x-ray. They said it's clear. Listened to my chest with a stethoscope, said it's clear. Did a CT scan of my head, said it's clear. And I said, guys, but there's something wrong. I've been following this, and I'm actually, my trends are keep getting worse and worse of absorbing oxygen in my blood. And I said, can I at least get monoclonal? Because that was one of my things I thought was a good thing to do early on. And they said, sorry, you're not a good candidate. And I asked him, what is a candidate? He said, well, you need to at least be obese, morbidly obese, and you have to have all these pre-existing conditions. And I didn't want to lie. I didn't want to say, hey, I have all these other conditions. So I said, okay, that's what I got to do. And I was sent home, came home, and moved forward a couple days later. It's now my birthday, 1 o'clock in the morning. Now I really can't breathe. It's about 84 pulse ox. My friend's message, including my other wonderful, wonderful physician friend that is in charge of an entire healthcare institution. I don't want to cover all the different names or the hospitals I went to or any of my friends, but he was ringing in my head too, told me exactly how important that was. And now it's 1 o'clock in the morning. Do I really get up and get my wife up? And yes, because it was that important of hearing that and knowing that his best friend was 50-50 chance of living because of not heeding those warnings. So we make the 45-minute drive down to another ER because I wanted to go to a different one because the other ones wouldn't help me. They checked my pulse ox. Said, oh, you're at 93. Listened to my lungs, said, there's nothing wrong. You need to go home. And here's where the advocate piece starts going in. I had to finally start saying, guys, I don't think I'm going to survive. The problem is, and I get it, I'll say it once again, they've got the census at this one hospital, meaning how full it was beyond full. There was people in the ER waiting days for a room. Excuse me. And I apologize. I just wanted to, I don't want to edit this video, so I'm just going to keep it rolling and keep it as is. And they said there's nothing we could do. I asked if I can get monoclonal from them. They said, no, you don't fit the criteria. I don't know where this criteria came from, Department of Health, I don't know who, but they said the identical same thing. I did not morbidly obese, didn't have all the check boxes in order to do that. And here's where it really started ringing true. If I am a doc and I've got 30, 40 patients, one after another, and each hour, and you come in and you look like you're in shape, yes, I got my pulse ox limits. I'm showing them, look, these trends are happening. That is just the first indication. Try to get them to differentiate you from somebody else because it is so different as far as how do you differentiate you from somebody else? You're just another person they're waiting to take care of somebody else that are, in their minds, obviously a lot more sick than you are. The one doctor I was telling you about that is head of huge systems. Here's the problem. You get in a car accident, you break your tibia, your fibula. I've broken many bones motocross riding. They know how to fix that. It's clear. There's the issue going on here. When you go in now with COVID, because there's so many unknowns, all you really got is these checkbox. Is the lungs clear? Yeah, it looked clear. Is the CT clear? Yes, it's clear. Can you hear? Yes, the pulse ox is here. Checkbox is checked, done. But you're like saying, but no, there's something wrong. I'm not going to survive. There's still issues here. You need to have that armed information to be able to help them help you. So now move forward. I go home. Tuesday, another telemedicine call because I'm thinking I'm not going to survive now after this, right? So I talked to telemedicine doc, you need to be admitted. What is going on over there? She says she's going to call the emergency room and tell them to admit you. Go now. It was about 4 p.m. in the afternoon. Okay, I go down there. The ED doc at a different hospital once again, because I kept going to different places to try to get somebody to listen to me. She said, no, you're fine. Your pulse ox is at 93, listen your chest, you're totally fine. I said, now here's where I got very serious. I'm going to die. I have no other recourse here at all. She got really upset with me and said, called a tech over and said, walk this guy around the emergency room, put a pulse ox on him and tell me where we're at. And I get it. There was a line at the door of people waiting to be seen. And this guy says, are you sure you want me to do that? And she's like, what are you talking about? Of course. He goes, he's already below 84. And she instantly, oh my gosh, we got to admit him right away. Gets an x-ray of the chest, a lot more blood tests. Unfortunately, it was all clear again. By the grace of God, another doc walks in and goes, no, we need to do an iodine CT scan of his chest. And that's when it showed exactly that I had COVID pneumonia. I don't know how, I'm not a doc. I don't know the differences, how they determined that. And then instantly, because I knew when I did the first telemedicine call on getting the albuterol, but then also steroids, how I felt better, finally, I got admitted to a room, given oxygen, given steroids right away, immediately. And by the next morning, I was still at a pulse ox with oxygen at about 88, but at least it stopped declining. And I could feel, not that I was going to survive, but I felt a huge difference of, okay, something at least is now happening here. And let me go into the next note here. So here's what the interesting thing was. So the doc that came in and told me the iodine or the CT, he said, let me explain what's going on in your body. You have a lot of antibodies going on, and it's like an intruder came into your house. And instead of you taking a pistol and just shooting that one intruder, your body took out an Uzi and lit up your whole entire house and just destroyed your house, trying to defend you. And in doing so, has inflamed your lungs to that capacity. And this is where I thought, man, this message has got to get out, because this is where people need to know to be an advocate for yourself, because that's what I need. I just need that steroid to reduce my antibodies, reduce the swelling, allow me to get oxygen. And after a couple of days in the hospital, started turning around, and I came home. They sent me home with oxygen. First, they didn't want to, and then they said, no, you need oxygen at home. And so for the third or fourth time, I will tell you, you can't yell at the workers. They're slammed. There's nothing they could do. You have to help them help you differentiate what makes you different. So not only one, but I got 2 pulse ox. Why? Because they're not that accurate. Like in the hospital, those are $5,000 machines. These can be off by 2 or 3%, but still close enough. My wife, at least I used her to calibrate. She would go 97, 98. Mine would drop 86. So I knew there was a problem, because at least I can compare with her. But at least with 2, it really helped me to be able to determine that. You got to be able to see a doctor anytime, day or night. After 5 o'clock, my doctor's office closed. Couldn't reach him. Still haven't for 2-3 days. I would have been dead by now if I didn't have the access to be able to see a doctor live over video, over telemedicine, to go, what can I do to have another advocate? And so my wife and I thought about it, and our main company here has always been, over the last, 23 years, of consulting with hospitals and clinics, sales, doing tech support, educating clinicians from around the world on how to start their own telemedicine program. Excuse me. But this experience was kind of more like a divine intervention of how can I use telemedicine that does have such a global footprint to be able to help people. And honestly, I didn't think I was going to be here this week. So we converted our entire website, got rid of all of our sales, put on a separate section, just to allow, doesn't mean you got to go to telms.com and get your own, but it's very low cost monthly service where you could see a doctor 24/7, 365 days a year, just while this is going on, to be able to have access to a lifeline where if you don't immediately have that. And hopefully it'll be a service that will help you or your family, or find another one like it if there is any that's within your price range. The other thing I could say is definitely get 2 pulse ox. They're like $20, $25. Worth every penny to have that. Blood pressure monitors, I've got a couple of them to at least be able to check on that. The other thing is religiously, for like in my case of having pneumonia, is having one of these exercise lung machines, you know. And the thing is, I asked the respiratory doc, I want to do this seriously and get better fast. And she was saying you need to at least do it 10 times an hour. So on my app on my phone, I don't have an app that could every 6 minutes alarm me. So I just went online and found an app that does multiple alerts. And I set it to every 6 minutes and take it extremely serious. So every other hour, I do 10 exercises for my lungs and then take an hour break and keep doing it. It makes me feel like I'm doing 500 sit-ups. But I'll tell you what, in a couple days, wow, significant difference of having those lower areas of my lungs I could feel open up, and I'm not coughing. I was coughing constantly. First, I couldn't even do 10, 20% of this. Now I can finally get to the very top and hold it, because you got to take it that religiously. And the worst part of all of this, the part that helped me survive in the beginning of this story, was my ENT surgeon buddy that he told me about, his great friend from childhood, and he texted me and said he died. And God, it's like he was a kindred spirit. That story is what saved my life. And I thought, God, I got to make a video or something to honor his life that allowed me to have mine, because I would have just gone home and waited like the ER told me to. And life is so short and precious. And hopefully share this video information. Hopefully it'll help you as an advocate, a family member, somebody else, what to do to help differentiate you. Don't yell at the clinic staff people. Every hospital I went to, they were nice. They just have so much to do, and there's only so many check boxes. And if you don't fit that check box, you don't get the medicine, you don't get admitted, you don't. And so you got to be able to help them understand, like our trends. You might not have Excel. Put it on your phone, put it on a white piece of paper of your pulse ox. Maybe you'll never get to the point like me with lung issues. But the thing is, like my buddy's friend that didn't know to check pulse ox, after it gets to too low, there's nothing they could do. This is viral, not bacterial, so it's not like you're taking an antibiotic to get over it. You need to be proactive and get in front of it. Anyway, so that's it. It's my story, and hopefully it'll help many of you out there, but at least if it even helps several, it's just too important right now to get this message out. Thanks.